Welcome back. Now, depending on the breed or type, a dog's sense of smell is around 10,000 to 100,000 times better than ours. They possess up to 300 million olfactory receptors in their noses, compared to about 6 million in our efficiency as human beings. Now, based on this attribute, a collaborative with veterinary schools in Finland and France, University of Namibia's School of Veterinary Medicine has embarked on an initiative to train sniffer dogs to detect COVID-19 in humans, a first for Africa. COVID-19 detective dogs are extremely effective in detecting people who are COVID-19 positive or negative. Dr. Conrad, who lectures at the University of Namibia in the physiology and epidemiology field, is one of the heads of the initiative and now joins us in studio to tell us more about this exciting endeavor. Doctor, good morning and welcome.
Good morning. Thank you.
Just give us a bit of background to start with, about this initiative.
Well, as you said, the whole world was thrust into this problem sort of in the deep end. It happened just over a year ago. And we saw an opportunity here in Namibia through the veterinary school to perhaps implement a program where we could, as you say, be possibly the first in Africa, but just develop something where we could utilize the fantastic skills of these dogs. And at the School of Veterinary Medicine, we have a beagle colony already. So we thought this would be the ideal opportunity. Of course, there were a lot of challenges in the beginning that you have to just overcome to get there. And you have to do it quite quickly because the whole pandemic spread really quickly. So for us to be effective and to make best use of it, we had to act very quickly.
Yeah. Just take us through the trials that you're currently going through for this initiative.
Okay. I suppose you should start at the beginning. When you do something like this, you do need to get samples that you can use for the dogs to sniff. And the critical point here is that a lot of people misunderstand is it's not the virus they're sniffing. It's the effect the virus has on the body of somebody that has the virus, which changes the metabolism of the cell in many ways, which produces compounds which result in a change in body odor, essentially. And this is what the dogs are picking up. So it's not directly the virus in any way whatsoever. And we picked up on this on a very, very early stage in consultation with our colleagues in France and Finland especially, on what the best samples are to get, how to get them. And of course, to initiate something like this, you have to have the approval of Ministry of Health, which was our first step. So we spoke to them and got that. Unconditional support from them, which is great. And then we had to figure out a way of getting the samples. And we went the route of getting sweat samples from patients that are positive and that are negative. It's a very non-invasive way of getting a sample. There's no danger of contamination or spread of the virus because, as I said, it's not the virus. And we went from there, and the training then started with the dogs, which is a multifaceted way of doing things. You first have to do obedience training, and you have to get through that whole process, and then you actually start the actual sniffer training for the COVID itself.
Yeah, sure. I have so many questions. Do you need a specific type of dog for this?
No, any dog would do. Some dogs are better received by people than others, and more non-threatening. Dogs with exceptionally good senses of smell are beagles, bloodhounds, German shepherds, Belgian Malinois, those type of dogs. But any dog can essentially do it.
And how many dogs
have you? The training.
How many dogs have you trained?
We've just been using the beagles and German shepherd at the moment.
All right. I'm sure there are skeptics wondering, how successful an initiative like this would be, using dogs to sniff out COVID-19. Talk to us about that, and also how successful it was in France and other places that have done this.
Absolutely, yeah. There are skeptics, of course, that probably don't realize just how good these dogs can be and how sensitive their smell is. And we're all on the same page in Namibia and in the world, really, of the few places that are doing it. And the results have been absolutely phenomenal. And it's based on studies in the past which have used dogs for sniffing out various other things. And for the COVID, using dogs as a screening mechanism could be an incredibly important method of speedily and accurately helping with the detection and prevention of the spread of the disease.
And where exactly would you ideally then use these dogs once they've been sufficiently trained? Would you use them at the airports or at the border post, or just amongst people in town?
Absolutely. Once we have a big enough cohort of dogs, then it can be decided where the best place to deploy them would be, and it would be probably border posts, airports, schools, whatever. And the important thing to realize here, they wouldn't go along a line of people and sniff it. The people would submit a sample as they stand there, a sweat sample, and the dogs would sniff it. And to date, between us and all the other places, the dogs have, if it's negative, it's negative. It's 100%. So you could screen out the negatives immediately. For the positive cases, they're extremely accurate, almost more so than the test. It wouldn't be a definitive test at this point, but it would be an indicator that perhaps this person needs to go back for another test or so. And it probably just as an indication to you of how accurate these or how sensitive these dogs are. It's something that happened to us and the people in Paris almost simultaneously, is that the dogs detected as negative samples as positive for some reason. And it took us a little while to figure that out. And
why was that happening?
It happened because when a female ovulates, she produces a similar odor to somebody with COVID. And this confused the dogs for a short period. But that just shows the level of sensitivity that these dogs have for small changes. And so it's very encouraging to see that our efforts are on a par with what's happening everywhere else in the world.
Other than that, any other challenges you faced with setting up this program?
Initially, we realized probably the biggest challenge was to get samples. It's a process that people don't understand. I think we're dealing with the virus, but we're extremely lucky to have had the support of the Lady Palmer Hospital. And we have a very strict collection protocol, and the way it's done, it's adhered to in a very professional and efficient manner, all under full PPE. We get the samples, it's a simple swab sample from a certain type of sweat gland in the body, and that gets given to us, and then we use that for the training of the dogs. So to get that initial permission and understanding of the sample collection was the most critical phase of the thing. And then, of course, the dogs are the heroes, and the dogs need good dog trainers, and we have we needed a very diverse team to make this whole thing happen. You need doctors, you need professional medical doctors, you need vets, you need dog handlers, you need the dogs, you need vet nurses. We even have a Supreme Court justice on the team, which really helps. So we've achieved a lot in a short amount of time.
That's fantastic and interesting to say the least. Well, thank you so much for being here this morning, Dr. Brian. Any final remarks from you?
We've had a very successful fundraising effort up to now, and our new facility, which is exclusively for training dogs, is busy being built at the moment. So through that, we hope to increase our cohort of dogs that we can use, involve various other institutions. We would love to have the police involved and train their dogs. We already take veterinary care of their dogs. So to be the next step is to try and diversify our approach up to now, and the success we've had has been phenomenal, so we want to expand it.
Fantastic. Well, thank you so much for your time. Thank you for being here this morning.
Okay, thank you.
That was Dr. Conrad Brian from the School of Veterinary Medicine at UNAM speaking to us. Dogs sniffing out COVID-19. It's definitely 2021, I'll tell you that.